Good afternoon, everyone, and thank you for joining us today to learn about the Captial Blue Cross SecureBlue Medicare Supplement Plan. My name is Karen Mcdaniel. I am the Director of Medicare and Compliance here at URL Insurance Group. For those of you not familiar with URL Insurance, we are a brokerage out of Harrisburg, Pennsylvania. We have 4 departments. We have the Annuity Solutions Department, which is headed up by Joseph Corio. We have the Health Plan Options Department, which is headed up by Christy Saul and Deb Wilkinson. The Life Markets Department, which is led by Steve Clemens. And the Senior Care Department, which is headed up by myself and with my staff, Alyssa and Janine. On this webpage, you can find the product information for Captial Blue Cross under the Product Information tab. And scroll down to the Medicare Supplement portion of the website. Can everybody see the screen?
Everybody can see it okay. Just give us a thumbs up. Just let us know that you can see everything and you can hear us all okay. All
Great,
right,
thank
perfect.
you.
Thank you.
So on the Captial page, you will need to have a login and password for the website, which I believe most of you probably do. And on here, you will find the benefit chart, the producer bulletin, the rates and outline of coverage, the application, and the general information of where to contact Captial Blue Cross for applications that were submitted or general underwriting questions. Presenting today from Captial is Michael Lindsay. And at any point during the webinar, if you have any questions, just please type it in the question box on the control panel, and at the end we will answer any of the questions. Also, if you have not RSVP'd for our 2015 Leaders Conference, you can do so by going to our website, which is urlinsgroup.com/leaders, and you can pick the sessions that you would like to attend. And also, we have a promotion running for, till the end of this month that if you submit a Captial Blue Cross application, you'll earn a $50 bonus, which is $25 from URL and $25 from Captial Blue Cross, and that is for any applications submitted this month that are for an April 1st effective. At this time, I'm going to turn it over to Michael Lindsay. Michael, go ahead.
Okay. First off, let me get into the slideshow here. All right. So I want to thank everybody for joining me today, and I also want to thank URL and Karen for setting this up. I know we had done the same PowerPoint presentation back in mid-November during AEP, and I'm sure many of you were out there selling. So I'm happy to have the opportunity to get back in front of everybody and reintroduce our SecureBlue Medicare Supplement plan. The SecureBlue plan first received AIP approval back in November, and so it was a hurry pace, and getting out in front of all of you was probably not convenient at the time. So that said, we have this bonus program out there, and we're excited to get back in front of you all. And today, what I'd like to do is kind of go over the rates. We've already done the introductions. Go over underwriting, the fitness program, which is unique to our SecureBlue program. The producer portal, which Kelly had shown you, or Karen, I mean, had shown a little bit of that at the beginning of the presentation. Go over the commission structure, which I'm sure is important to all of you, and then we'll wrap up with some questions. So we'll skip the introductions. SecureBlue is underwritten by Capital Advantage Insurance Corporation. It's a subsidiary of Captial Blue Cross. Captial Blue Cross is an independent licensee of the Blue Cross Blue Shield Association. Okay, legal mumbo jumbo is out of the way. Once again, we did receive PID approval in November, and January 1st effective date for this year. available to beneficiaries living in Blue Cross County service area. So yeah, the members sign up within our area. However, if they do move out of the Blue Cross service area, they are to SecureBlue. We have 5 hospitals for the offering. We're running against A, B, C, F, and N. And being able to, as you know, an A is A, B, C, F is an F, and N is an N. So I'm not going to spend a lot of time going over this with you. That said, the SecureBlue rate, it's based on age. On January 1st of next year, the 2016 rates will go into effect. So anybody that has a birthday during this calendar year, their age prior to January 1st will be the age that they receive as of January 1st, 2016. There's 3 categories with this product. There's the obtained age 65 and yearly thereafter until they're 85, and then they're held flat and first eligible disabled rates. That's for people who are first eligible for Medicare based on disability, and then Medicare disabled age 0 to 64, and those are for the people that missed that first eligible within 6 months of first becoming Medicare eligible with disabilities. As you can see here on this chart, at age 65, just to give you a little idea, Plan C is $136 per month, and Plan F is $138. And then all the way to age 85, every year the rates do go up. During your Medicare disability, your Medicare disabled rates, you can see that right down there. Once again, if they were to enroll during their 6-month open enrollment period, for this year, the rate is $136 for Plan C, for example, and $138 for Plan F. If they were to enroll outside of their 6-month open enrollment, the same Plan C would cost them $253 for Plan C and $256 for Plan F. So those are the rates, and they do go up annually. For the underwriting, it's really quite a simple underwriting process. If they are age 65 and at least within 6 months beyond their enrollment in Part B, they will have to be underwritten. So as long as they're within their open enrollment period during that 6 month, there is no medical underwriting. If they do or are subject to medical underwriting, then they have to answer all the health questions that are in the application. There's about 2 pages, 1 3/4 pages of questions. All the answers to the health questions have to be answered to determine eligibility, and if any answer is answered yes, then the application is not eligible, or the applicant. So basically, if they're subject to underwriting and they have a question, or if they answer yes to any of the questions in underwriting, then you could stop the application there because it's they're not eligible. However, if they answer no to all the questions, then they're automatically eligible for coverage. Basically, if the applicant is required, once again, they have to answer all the questions. If they're unsure, so if you're in the interview process and they're unsure, please don't direct them how to answer. Refer them back to their physician to answer the question. The other thing down the road is we will be checking the applications. We have a pharmacy network that we go through to check the applications that are underwritten, just to make sure that they are answered truthfully when they fill out the applications. When does underwriting not apply? Basically, as I stated, during their Medicare open enrollment period, which is a 6-month period following enrollment in Medicare Part B, begins the month their Medicare Part B begins. Pre-existing conditions can still apply unless waived for credible coverage. If they have a balanced budget reason, underwriting would not, and that's basically a guaranteed issue right where maybe they came off an employer plan, if their plan had dropped their coverage, if they retire. And remember, if they're coming off prior credible coverage, 63 days is required. And then second is their second Medigap open enrollment period. So when they become Medicare disabled, and then if they're Medicare disabled and then they turn 65, once again, the underwriting questions would not have to be answered. So once again, about balanced budget acts, if you're covered by a group plan, so if group benefits supplement Medicare and the group terminates, or group ceases to provide supplement Medicare health benefits, or the group plan is primary to Medicare and the plan terminates, or an individual leaves the plan. And also note that COBRA coverage counts the same as group coverage. Notification requirements. It's important typically when people come off of group coverage, they'll get a notice from their employer. And if that is your balanced budget reason, we will need documentation as to their balanced budget reason when we go through the process. So if you're meeting with the people and you know they're coming off a group plan, please make sure that they have a letter and that you can also scan that in at time of application. Pre-existing conditions, once again, is any health condition diagnosed or treated within 6 months prior to the effective date of coverage and would not be covered for the continual 6 months or the next 6 months. Pre-existing conditions are obviously waived if there's a Balanced Budget Act or prior coverable coverage. Lapses less than 60 days from termination once again apply. So basically, if they're leaving an employer plan, they have 63 days to obtain credible coverage and avoid pre-existing conditions. Another thing with this application is instead of using your broker number, and we've had quite a few applications sent over where they're using their BRK number, we, for commission purposes, are using your NPN numbers. So on the application where it asks for the broker or producer ID, we would ask that you fill in your information and use your NPN number. If, and I'm sure most of you know your NPN, but if for some reason you didn't know your NPN, I've provided a link within the presentation and some instructions on the next slide on how to obtain your NPN. I'm sure most of you know it, so we're just going to kind of cross over that. With SecureBlue, one of the really nice things, and I think this has been a huge selling point for us so far in the market, and it's really helped producers that we do work with, is we have a fitness program that is free to the beneficiaries. So if they sign up for our SecureBlue product, they do get a fitness program that is free. And with that, they can join gyms in their area. We have a listing available online, and it's also available in paper form of gyms that are in the participating network. Basically, all the members have to do is call our Silver and Fit department, and they will go ahead and get them set up for their gym memberships. It's really easy. The other thing, too, is there's a home fitness program associated with this, so if people don't want to go to the gym, they can get CDs for things like Tai Chi, yoga, strength training, and they can get up to 6 CDs for them. And Silver and Fit is run through Ash Fitness on behalf of Capitol Blue Cross. So that's really a great selling point. I know when I've been out at Medicare seminars, people have been really excited about having that. They do see it as basically a $20 or a $30 bonus to them per month. Next thing is the producer portal. As stated earlier, if you're able to get out to the producer portal, if you've logged in under URL, there is all of the documentation out there. You can download an application online. You can find your evidence of coverage. So all the documents that you would need for an applicant are there for you as well. Also, if you would like paper kits, if you're somebody who enjoys having paper kits when you go out to employees, you can request through Karen at URL packets, and I will be happy to send those packets out to you through the mail. Just make sure you include your name and an address to have them sent, how many packets you would like. So they are available for you online, all the information, but if you want physical packets, once again, I'm more than happy to send you out as many packets as you need. There is no limit, so I would be more than happy to send out as many as you need so we can start selling. On to probably the page most people want to see, the commissions. So for plans A, B, and N, this for all of you, the commission is $150 or $12.50 per month, and all commissions are paid on a per month basis. Under 65, the commissions are $30. And for plans C and F, the commission is $30 or $25 a month. And for those under 65, it's $60 or $5 per month. So that's for the commissions. And the commission structure is renewed for 6 years currently, but we are looking at that as an organization. So, you know, kind of the final little sales pitch here, why would you choose our SecureBlue? We think right now we have competitive rates, and we'll continue to have competitive rates going forward. Obviously, the strength of the Blue brand, I know all of you know when you're out there and you talk about Captial Blue Cross, it's a name that people know. It's a name that they trust. It's easier to sell. Your free membership in the Silver and Fit program, and like I said, it really has been a very, very popular program and selling point for our membership so far this year. We're local. It's local customer service. We're member-centric organization, so we're very member-focused. We're going to concentrate on the members that you do send over. We're going to treat them well, and obviously our customer service speaks for itself. So that's why you should sell us. Here's some website information. It's capbluecross.com. There's an 800 number, which actually goes to my desk, so I would be the person that would answer that. It's 888-549-9452 if you need to get a hold of me, if you have packet requests, if you need to reach out to me. If you have any questions about the product at all, don't hesitate to give me a phone call. If you want to email, this is a general email box. There's multiple people that check it. It's cbcmspi@capbluecross.com. And if you're out and you're taking applications, there is a fax number that you can fax. It goes directly to our enrollment folks at 717-651-8266. So if you're old school and you want to fax them in, there's also the ability on the website that you can submit your applications electronically. So if you're out at a customer's house, or if you have them into your office and you want to just submit the application online, please do so. It goes directly to our enrollment folks. Just once again, make sure that you fill out your producer information and that you include your NPN in the producer field. And at that point, I'll open it up for questions. Once again, I want to thank you all for the opportunity to once again kind of talk about our SecureBlue product, and hopefully down the road here we'll see a lot more applications. If you have any questions at all, please don't hesitate to reach out to me, and I look forward to working with all of you going forward. Thank you so much.
Okay, Mike, we do have a couple questions here. We had an agent who signed on a little bit late, and he's asking, are the rates the same for male and female?
Yes, and I probably should have pointed that out. There is no different underwriting for men and women. Basically it's just age-attained rates. There is no smoker, non-smoker underwriting. Basically, as long as they can answer the underwriting questions if they're subject to underwriting, and every single answer is no, then they qualify for the plan.
And can you repeat what you said about the COBRA coverage?
Basically, COBRA coverage does qualify. So if somebody were to retire and they wanted to remain on COBRA coverage for one reason or another, it does qualify as credible coverage, so pre-existing does not count. So if they come off of COBRA, once again, they have that 63-day period, and they still would not be subject to pre-existing conditions.
And the last question that we have so far is, why do we take such a haircut on disabled commissions for people that are under 65?
You know, that's not to sidestep it, but that's more of an underwriting or an underwriter question. I don't handle the commission structures, but it's something I'll be more than happy to go back and see if we can look at how we are in the marketplace and how we stack up versus our competition, and it's something we can always look at if that's a concern.
A couple more questions came in. Can you kind of go over the service area, maybe list the counties that the product is available, because it is not available throughout the state or the entire state?
Sure. Unfortunately, I don't have all 21 counties memorized. They are available on our website, and also I'll be happy to send out an email communication to everybody with the 21 counties. I can probably...
It's a South Central Pennsylvania 21 county service area, right?
Yep, it's all of Capitol, yeah. So,
And
it's the same service area as Capitol Blue Cross. Go ahead.
And the last question we have, the rates are the same for the entire service area. It doesn't matter about if you're in Schuylkill County and then you're in Dauphin County, the rates are going to be the same.
Correct, yes. It's for the entire 21 county area. The rates are the same.
Okay. Any other questions? If not, we're going to close out the webinar. If you do have any other questions, if you think of anything after we end the webinar, please feel free to send myself, Janine, or Alyssa an email, or to Michael directly at the email address he provided, and we will get that answered for you. Again, thank you to Michael for taking the time to join us today, and thank you all for joining us as well.
Thank you.
Have a great day.